I'm Dr. Bowers, and I will be discussing the hip drop test and lumbar side bending. The first thing that you want to do is have the patient stand with their feet about shoulder width apart, and you, the observer, should be standing far enough back that you can get a good view of their low back as well as their hips. Some people might find it helpful to kneel down so that your eyes can be at the same level of the hips, but that is not always necessary. So the first thing we want to do is look for any gross deformity or any asymmetry. And looking at this picture, if we compare our fingertips and where they sit, the right fingertips sit a little bit more inferior than the left ones do. Looking at that closer up, we can see how that lumbar curve is a little bit towards the right, how those upper lumbar vertebrae sit a little bit more to the right of a line dropped mid-sagittally. And there are other asymmetries as well, but since the hip drop test tests lumbar side bending, we will limit our focus to the lumbars. Next, you'll instruct the patient to keep both feet flat on the floor and ask them to bend one knee, allowing the hip on that side to drop down as much as it comfortably can. Then straighten that knee and then repeat on the other side. Meanwhile, you, the observer, are watching their hip to see if it can drop down about 20 to 25 degrees inferior from the horizon on the side that they're bending the knee. Also, if you have an unobstructed view of the lumbar spine, you can watch to see how well it side bends to the side opposite of the knee that is being bent. A positive hip drop test means that the hip did not drop all the way to 20 or 25 degrees on that side. In the picture to the left, we have someone performing the left hip drop test, and the picture to the right, they're performing the right hip drop test. What we can see here is that that left hip does drop down that 20 to 25 degrees inferior from the horizontal, but when they do it on the right, it does not drop down that far. So it is a positive right hip drop test. Also, when looking at the lumbars, the picture to the left, you can see how that lumbar spine curves towards the right, so side bending to the right when they drop that left hip down. But in the picture to the right, when they're trying to drop that right hip down, that lumbar spine still looks pretty straight. So what we have with a positive right hip drop test is that the lumbar spine does not side bend well to the left. It is possible in someone who has a lumbar spine that does not side bend very well either direction that they would have a positive hip drop on both sides, that neither hip would be able to drop down to that 20 to 25 degrees. Watching it in motion, you can see when doing that left hip drop test, it does go down 20 to 25 degrees, but on that right side, it did not go down to the 20 to 25 degrees. Sometimes when you're starting out, it's difficult to be appreciating more than one area at a time. So let's watch it again, but this time pay attention more to the lumbar area. And with this, you can see that when the hip drops to the left, the spine does seem to bend towards the right. But when doing the right hip drop, that lower lumbar spine does not seem to be able to bend towards the left very well. All special tests that examine range of motion have their limitations because it is impossible to isolate just one area from the rest of the body. As far as the hip drop test, musculoskeletal issues can affect the results. So if the knee doesn't bend very well or there's some other issue in the leg, you may have a positive hip drop test even if the lumbar spine has no issue side bending towards one side or the other. Clinically, it can be useful to look at the active range of motion of side bending in the lumbar spine. And one way to do that is to have the patient standing in that same exact position as the hip drop test, but instead instruct them to slide their fingertips along the outer edge of their leg down towards their knee or past it as far as they can comfortably go. And then compare that to the other side. If they're wearing bulky clothing or clothing that obstructs your view of the spine, you can look at how far down the fingertips went. And in this picture, if we take a transverse line through the popliteal fossas, we can see how the right fingertips were able to travel more inferiorly than the left fingertips. It is good to be able to actually see the spine because this too has limitations in that things in the upper extremities, shoulders, upper back, and rib cage can affect someone's ability to bend towards that side. So when we look at the lumbars in these pictures, what we can see is in the picture to the left, when side bending to the left, the lumbar spine low down in your L4, L5 area here actually is still trying to be side bent to the right, while the middle and upper lumbar spine is able to side bend towards the left, as seen with these red lines drawn. Now when we look at the picture to the right, where the fingertips were able to go down farther, suggesting that the lumbar spine could side bend better to this right side, and we look at it, that right lower lumbar area is still side bent to the right. The middle looks like it is also able to side bend to the right, but that upper lumbar area actually looks like it is a little bit side bending and being more towards the left, as shown by these red lines. Let's watch that in motion, and since we have a pretty much unobstructed view of the low back, we'll focus our attention there at those lumbars. Bending to the right, noticing how that middle lower lumbar spine bends well to the right. But when bending to the left, you don't really see a lot of good motion in that lower lumbar spine because it is side bent to the right and doesn't want to bend to the left. In summation, the hip drop test is actually a test most often used or described to get information about lumbar side bending. But know the limitations of your special test so that you can properly make sense of the data and use it in combination with the rest of your physical exam. Remember, while visual observation can be helpful, it does not replace actually palpating the area of interest so that you can appreciate static as well as dynamic musculoskeletal findings.